If you're covered by Blue Cross Blue Shield of Tennessee tonight, your card is no longer welcome at Methodist Le Bonheur Healthcare. You are now considered out of network because the two parties failed to negotiate a new contract. Stefan Reels is here now. And Stefan, we know it all comes down to money. It always does. Methodist wanted more than Blue Cross was willing to pay. Why don't you break it down more for us?
Okay, Richard. Well, Blue Cross Blue Shield of Tennessee blames Methodist, accusing it of driving up healthcare costs, while Methodist says it remains relatively competitive despite things like the pandemic and inflation. Whatever is to blame, when December 31st deadline came and went, the two were unable to reach an agreement, leaving many patients in a bind.
Several Methodist facilities have now been removed from Blue Cross Blue Shield Tennessee networks. The locations on your screen have been removed from Blue Network P, Blue Care Tennessee, 10 Care Select, Cover Kids, and the Dual Special Needs Plan. Methodist Le Bonheur Children's Hospital and Methodist Le Bonheur Germantown have also been removed from Blue Network S. While Methodist facilities won't be covered, the doctors employed there are still in network, so it could still be possible to see them at a different hospital. Blue Cross says a new contract was needed because the rates Methodist Le Bonheur healthcare system charged were significantly higher than their average rates for other facilities in the Memphis area. And in the case of Methodist Le Bonheur Children's Hospital, their rates were the highest of any children's hospital in Tennessee by far. Blue Cross says it hopes to find some solution that would bring the Children's Hospital and the Germantown location back to network. Methodist released a statement saying MLH has absorbed major cost increases between the pandemic, inflation, labor shortages, and supply chain disruptions. MLH claims it offered Blue Cross a deeply discounted rate to keep patients in network, and says Blue Cross continued to refuse the offers and made unreasonable demands. Methodist says you will need to contact Blue Cross Blue Shield to understand if your procedure or surgery will be considered in network.
Right now, Blue Cross Blue Shield is asking coverage members currently being treated at Methodist facilities to call them using the number on the back of their member ID to make sure they're still in network and to arrange care. You can find a full list of impacted plans and locations on our website, abc24.com/now. Richard?
All right, thank you, Stefan.